Good morning and welcome to Medicare Made Easy, a live stream session Blue Cross and Blue Shield of Louisiana is proud to host to share information with you about health topics of interest to adults 65 and older. I'm Kandyce Cowart. I'm the manager of special investigations here at Blue Cross. And joining me is Brice Mohundro, a pharmacist who is part of our care team here at Blue Cross.
Hi, I'm Brice Mohundro, clinical pharmacist of population health here at Blue Cross.
As we're joining you today, we're in the middle of tax season, and that combined with the COVID-19 pandemic and recently issued stimulus checks has created a situation that scammers are taking advantage of and are tricking people to hand over their money and their personal information. Unfortunately, here at Blue Cross, we have received reports of some of these types of fraud schemes. During our time this morning, I'll be talking about some of the information that we know about scams, and I'll be able to share things that you should watch out for to avoid becoming a victim of fraud.
And we've all been spending more time in our homes over the past year. So it's important to be aware of what's in your medicine cabinets to avoid having your prescription drugs get stolen, misused, or abused. This past weekend was Spring Drug Take Back Day, which is an annual observance the DA hosts to raise awareness about medication safety and proper drug disposal. Kandyce, can you share with everybody what the turnout of this last weekend's event was?
Absolutely. We had a fantastic turnout. In our event in 2019, we collected 1,000 pounds of medication. But this past Saturday, we had 245 cars pass through our drive-through drop-off. We filled 70 of the Drug Enforcement Administration's disposal boxes, and the total weight of the medication was 1,750 pounds. So this will be millions of dosage units of opioids and other medications that now won't be on the street.
That's great. Glad to see such a wonderful turnout this weekend. Thanks to a partnership Kandyce and I work on among Blue Cross, the Louisiana Attorney General's Office, and the National Association of Drug Diversion Investigators, we've gotten secure drug drop boxes placed in parishes around the state. You can use these 24/7, 365 days a year to safely get rid of your old, unused, or expired medications. I'm going to share some information about why this is important, along with some general medication guidance. First, Kandyce, why is it especially important for adults on Medicare to be aware of fraud and how to avoid it?
It's very important for people of all ages to be aware of the fraud schemes that are going on, but it's particularly important for older adults because they are the ones who are most frequently targeted. The FBI estimates that millions of adults 65 years and older are fraud victims each year, and the monetary losses resulting from this are over $3 billion. Criminals often go after older adults in the age group 65 and older because these people are more likely to own homes. They're more likely to have substantial savings accounts. They usually have good credit. So all of these things are very attractive to scam artists. Also, people of this generation are much more trusting. They trust people, and that makes them much more likely to answer a cold call or to have a conversation with a stranger. To prevent being a victim of fraud, you should never worry about being rude. It is perfectly acceptable to not answer a call, not respond to a text, and it's also certainly okay to hang the phone up if someone asks for your personal information or financial information. If something doesn't seem right, just don't engage. You don't have to worry about being rude.
And as a general rule, you should be suspicious whenever anyone asks you for money or for your personal, financial, or healthcare information. That's true if it's a stranger, but keep in mind that scammers will pretend to be calling you on behalf of your provider's office or your pharmacy to ask for your healthcare information. They could be trying to bill your health insurance for a service or a prescription that you didn't have. And if the person claims to be calling on their behalf, but is asking you about a drug or a treatment you've never discussed with them before, that's usually a sign it's a scam. You should always verify an outreach you get with a provider's office or pharmacy. If it's real, they will not mind you taking the time to confirm they really need a payment or your insurance information or other sensitive details before you respond.
Another common scam that I'd like to talk to you about is a scam that involves a scenario where items are shipped to your home when you actually didn't order them. You may receive pills or pharmaceutical creams or ointments, a foot bath, which is like a nice foot soak spa that you put medication in, or even other medical devices and durable medical equipment that might be sent to you without your provider's knowledge. If these items show up at your home and you didn't order them, you need to contact your provider immediately. You should not use these items. Many times they can be shipped to your home solely for the purpose of billing insurance. This practice involves using your benefits for someone else's gain. You should never, ever take medication or use anything that is sent to you without first checking with your healthcare provider. It could potentially hurt your health. As Brice said, even the person sending it claims they claim to be your provider or your pharmacy. They may say they're from your local pharmacy or say that they're from your doctor's office. If you're not already familiar with that person, you need to double check and make certain that they say who they say they are. Another good tip to avoid fraud it's okay to be rude. You can ignore cold calls, emails, text messages, or any type of other outreach, especially if someone is making you uncomfortable or if they express a sense of urgency. If they tell you there's just minutes to respond, you need to respond quickly. You should be very suspicious of that and not fall into that. You can hang up, delete the email message, delete the text message, or just walk away from the person if it's in person. If you meet someone online or through social media or maybe a dating site, and that person asks you for money or your confidential information early on in speaking with them, that's definitely a red flag. There's something called catfishing, where people will meet you and will ask for your personal information. And this is something that you should be very aware of. These are scammers that create an online persona solely for the purpose of building up a perceived relationship with you and then getting you to hand over your finances or your personal information to them. While most of us are a little suspicious of strangers, scammers realize this. So sometimes they pretend to be someone that we know. They may pretend to be a family member or even a grandchild. They'll use tactics such as claiming that they're stranded in another country or they've been arrested. This particular scam happened in my own family. My father-in-law received a phone call from someone claiming to be my son and saying that he had been arrested and needed money. And he even knew the specific name to call my father-in-law. So these is a very prevalent scheme that you need to watch out for. Any out of the blue request for financial information or money, you should be suspicious of it and definitely check with someone else before you respond. If you think that you've been a victim of fraud, you should report it right away. What we have on the screen is the FBI reporting numbers, tips.fbi.gov and ic3.gov. And then that's that phone number to the FBI. And then the number at the bottom is the Blue Cross fraud hotline number, 1-800-392-9249. And that complaint will come directly to my fraud team at Blue Cross. If you've been approached by someone claiming to be or reaching out on behalf of your healthcare provider or pharmacist, you need to report it. Blue Cross members should report directly to our hotline, and others should report to law enforcement. I'm going to pause here to see if anyone in the audience has any questions about anything that we've talked about. Okay, I don't see anything in the chat right now, so we'll go on to Brice and we'll keep checking the chat for your questions.
To switch gears, I'm going to talk about drug safety and medication management. Nationally, drug abuse and overdoses increased during the COVID-19 pandemic. There were more overdose deaths in the US in 2020 than in any prior year. Unfortunately, a lot of drug abuse, including opioid abuse, which we've heard a lot about in recent years, starts within the home. People are prescribed a painkiller or other drug for a legitimate purpose, then keep it around when they finish taking it, and that creates a situation where it could fall into the wrong hands. It could get stolen, or it can get abused by someone else in your home or someone visiting your home. In addition to avoiding drug abuse, we've all been spending more time at home, and you want to prevent your children and your pets from getting a hold and ingesting these drugs as well. This could be very dangerous for them. That's why we partnered with the Baton Rouge Health District and Baton Rouge Police Department to hold the socially distanced drive-through event we spoke about earlier over the past weekend for people to clean out their medicine cabinets and get rid of their old, expired, and unused drugs. But if you couldn't make it this past Saturday, you can take advantage of the secure drug drop boxes statewide that I mentioned earlier all year long.
That's right. Blue Cross works with law enforcement agencies throughout the state to place secure drop boxes where you can get rid of old, expired, unused, and unwanted medications year-round. Drop-off is anonymous and no questions will be asked. These boxes are provided through a partnership with the Louisiana Attorney General's Office, Blue Cross, and the National Association of Drug Diversion Investigators. We currently have 75 boxes in 51 different parishes, and we're on our way to our goal of having one of our permanent drop boxes in every parish in the state of Louisiana. You can go to bcbsla.com/safe drug drop to see a map of the permanent drop-off sites and find a location near your home. Our ultimate goal again is to have a drop box in every parish. As we place more boxes, we'll update our map. So check online for the latest information.
Another important aspect of drug safety is to have a conversation about any concerns you have with your provider or your pharmacist. If you're prescribed a painkiller or other drug that makes you worried about the potential for it to be abused, tell your provider that and ask them about alternatives. Just because they prescribed it, there may be other medications you can take. The same goes for any drug concerns you have, not just addiction or abuse. If you don't want to take a drug because it gives you unpleasant side effects or it's too expensive, tell your provider or pharmacist that. It is okay to ask for other options. Your provider or your pharmacist would rather you speak up and tell them if you're not comfortable taking a drug for whatever reason than to assume you're taking it and have your health issues go unaddressed. Your provider and pharmacist are your partners to work with you in having good health outcomes, which can often include taking medication exactly as prescribed. If you have a condition like diabetes or high blood pressure, taking medication exactly as your provider tells you is critical for keeping your numbers in a healthy range. So let your provider or pharmacist know about any concerns and find something that works for your situation. That will set you up for success in sticking to your medications. If you're new to Medicare, Blue Cross has plans available that include prescription drug coverage with options for mail order and 90-day supplies that can make it easy for you to stay on track. Does anyone in the audience have any questions about medication or safe drug disposal?
Brice, I see that we have a question about what should I do to protect my children's medical identity? Would you like to take that one? Or would you like for me to take it?
Go ahead.
Okay. So I know that Blue Cross offers several different options to where you can have a company that watches over your identity. I know my family uses one of the big nationwide companies. So we definitely recommend that you reach out and utilize one of the companies that will help protect your identity, and we'll be out there looking if any of your family's personal information pops up anywhere. You'll be alerted about that. Other things that you can do would be just simple things. Don't dispose of a prescription bottle in the garbage can. Don't just throw that whole bottle with a label in the garbage. Go ahead and remove that label before you safely dispose of the empty bottle. Another way that you can protect information in your home is to have a shredder in your home, or to keep things that have personal information on them and take them to one of the local shred days. Brice, did you have any other tips about that question? Are we ready to move?
That sounds good, but it looks like there's another one. I'll take that one if you'd like.
Sure.
Okay, so how can I get rid of medicines even if I can't get to a drop box? Can I throw them away in my trash or garbage disposal? So Kandyce hit on this a little bit. So you want to remove those labels first of all. And another thing that you can do is either mix the medication with some kitty litter or coffee grounds or just some other unpleasant substance. So that way people don't have access to the medication that could be dangerous, and then throw that in the trash. But it is okay to throw those medications away if you take some precautions.
Okay, so I see we have another question. The question is, what are tips to warn older relatives about scams without insulting them, making them feel scolded or stupid? So we definitely don't want to make anyone feel stupid. This is such a complicated topic. And I've worked in this industry and in law enforcement for almost 30 years now, and there are still new scams that I'm not aware of. So no one should ever feel stupid. And the biggest thing is just getting the word out. I know in my own family, my grandmother, after me being in the industry for 20 years, fell victim to one of these scams. So unfortunately, no matter how often we say it, there are still some really, really tricky scam artists out there. But I would say that the biggest thing is just education and communication. Reach out to everyone that you know. If you're a younger person, reach out to the older people in your lives. And if you're already over 65, maybe have a conversation with a younger person, or just reach out to us at Blue Cross. And we try to share information about the scams that we become aware of. There are so many of them right now. So education is really key. Anything else for that, Brice?
No, I think that was good.
Okay, great. So I see we have another question. I've heard of something called skittling or skittle parties. So this is also known as farming, but it's farming with a PH, like a pharmaceutical farming. This is a nationwide trend that we are very concerned about. Regardless of what you call it, it's a super dangerous trend. So back in my 20s, when we used to go out dancing, we had to pay a cover charge to get into parties. Well, today's cover charge, unfortunately, is not a monetary amount, but it's an amount of pills. So what's happening is the young people in our communities are being invited to these parties, and they go in the family medicine cabinet or a neighbor's medicine cabinet, and they just go through every bottle and take out a few pills. And they're not even looking to see if this is blood pressure medication or birth control pills or heart medication, or potentially maybe an opioid left over from a surgery. So they take all of these pills, they go to the party, and their cover charge to get into the party is to hand over all of those different pills that they've collected. Then once everyone arrives at the party, they put all the pills in a big bowl, they mix the bowl up, and unfortunately, what you do at the party is just take a big handful of pills and swallow the big handful with absolutely no regard for what you're taking. Obviously, this is an incredibly dangerous trend and is resulting in overdose deaths all over the country. COVID isolation has really made the opioid problem much worse. This is one of the reasons why Brice and I do as much work as we do in the community, trying to educate people. During 2020, we saw more overdose deaths than in any other time in history. So we really are at a crisis point with the opioid epidemic, and this trend, skittling, farming, is one of the most dangerous parts of that. So what other questions do we have? Brice, do you want to take that one, or you want me to take it?
I can't see that one.
Okay, it says, if I got scammed and they used my health benefits, what should I do? So you should definitely report it. If you're a Blue Cross and Blue Shield of Louisiana member, please report it to our fraud hotline. That's the number that I gave you. And if you are not a Blue Cross member, you can report it directly to either of those FBI websites. We have them on the screen again. So yeah, either of those websites for the FBI or that hotline number for the FBI. And if you're a Blue Cross member, we definitely want you to call our fraud hotline number so that we can find out about that. And really, by sharing information, you should never feel embarrassed. So many people that call our fraud hotline say, I'm so embarrassed. I can't believe that I fell victim to this. I'm stupid. I should have known better. Once again, these scam artists are very, very good at what they do, and they're very convincing and make a situation look real even when it's not. So don't be embarrassed. Call, even if you're not sure. If you had a phone call, you provided some information and you're not certain whether it was a fraud or not, reach out to someone. Give us a phone call at Blue Cross. Let us check into it. And in doing this, you're protecting yourself, but you're also protecting everyone else in the community. The more often we can get information about the scams that are going on and we can look into them and share that information, the better off everyone will be.
And Kandyce, is there anything law enforcement can do about those parties?
Um, law enforcement is looking into it. Obviously, if they become aware that the parties are happening, they will stop them and try to educate and make arrests occasionally. Unfortunately, the kids in the community are really good at hiding them. So the majority of these types of parties go on without law enforcement knowledge, and we only find out about them, unfortunately, after there's an overdose at the scene.
So just another reason why these drug take back day events and drug drop boxes are so important to our community.
Absolutely, Brice. That's a great that's a great point. We mentioned that 1,750 pounds of medication that we got out of the medicine cabinets on Saturday, and there's no telling how many overdose deaths we potentially avoided with that. I see there's another question. My mother has been getting calls from companies asking her to switch to their pharmacy to get all of her medications from one place auto-filled. Is that safe? Brice, will you take that one?
Yeah, I'll take that one. So this is a getting all of our prescriptions on the same time, the same pharmacy is something called medication synchronization, which is great to help medication adherence. However, if you are not the one asking for it and it's not your pharmacy, I would not recommend switching your medications without doing some further research. Like Kandyce said earlier, it could be companies that aren't even associated with your pharmacy, your benefits, your provider that are trying to get you to switch. So just do some additional research into that before you do that. It is a great idea to get all of your prescriptions from one place to help with, like I said before, making sure you're taking your medication as prescribed, and that way the pharmacies can check for any drug interactions, but also want to make sure that we're doing it in a safe manner that is accurate.
And Brice, what about that next question? Where can I find help if I know that someone is having trouble with prescription drug abuse?
There's lots of different resources in the community that you can look for. Blue Cross also has some information, I believe, on our website. Let me see what the next one. What are tips to take medicine, especially for older people who may take lots of medication and have trouble keeping on top of it? So there's lots of different things that you can do to help with medication, to remember to take it. So one of the things that I like to recommend is to put it somewhere, either next to your coffee pot or next to your toothbrush, somewhere where you're doing that event every single day, and it's a reminder to remind you to take your medication. Other things that are available are pill boxes, so you can organize and sort all your medications by time of day. They have some that are just Monday, Tuesday, Wednesday, Thursday. They have others that are split up into morning and afternoon. Then they even have some that split it up into 4 times a day, depending on the medication regimen that you're on and your need. There's also a lot of new apps that will remind you to take your medication using your timers on your phones. Is also another good recommendation, or even if not a timer on your phone, just a timer within your house or on your watch to remind you to take your medication, or some good things to remember.
Great. I'm going to circle back to one of the earlier questions about the mom receiving calls from companies asking her to switch. So Brice addressed the perspective of if it's a legitimate situation. Maybe it's a pharmacy that you've used once or twice and they're trying to get you to switch to them. But I want to emphasize that if you receive a call from someone trying to switch your medication, or and it's a pharmacy that you have never heard of, or if someone calls and says, oh, well, your physician told us that you need this medication, so we're going to ship it to you, ask them, what physician are you referring to? And then if they give you a doctor's name that you're actually familiar with, call that doctor's office and ask them if they really called in that prescription for you, because right now that's one of the very prevalent schemes that we're seeing. All right, let's see what other questions we have. I'm not seeing anything else in the queue. Let's see, how common are scams in Louisiana? The numbers. So I don't know the exact numbers about all the different scams or how common they are, but I can tell you from experience, especially working in the Blue Cross fraud unit, they are very, very prevalent. East Baton Rouge Parish is considered one of the top 10 areas across the United States related to healthcare fraud schemes. Our parish has a special designation by the government that marks us as an area of particular interest and of particular caution. And the vast majority of those schemes are directed at the elderly, unfortunately. So it's very, very prevalent. When I meet new people and tell them what I do working at Blue Cross in the fraud unit, some people are confused and they don't understand why I have the job that I have. But we actually have a large team. We have a team of 14 here at Blue Cross that's fighting fraud. We work closely with Brice and all of our pharmacists, as well as our medical directors, to try to stay on top of all the scams. All right, well, I think we are getting close to the end of our time, and I don't see any other questions. All right, well, thank you all for joining us today. Thank you, Brice, for co-hosting with me. If you have any other questions, I'm sorry. If you have any other questions, drop them in the chat and we will answer them as we are able. You can always call Blue Cross. Our fraud hotline number is out there for you. Please call and report anything. And if you're not a Blue Cross member, you can still report something to us if you don't have any other source to report it.
Yes, and our care team and others will be hosting some upcoming Facebook broadcasts to talk about mindfulness, healthy eating, keeping up with your care, and more. You can visit our Blue Cross and Blue Shield of Louisiana Facebook page to see event dates for future live streams, including more Medicare Made Easy broadcast. You can also visit and subscribe to our Blue Cross YouTube channel to see recordings of past Facebook Live events that you may have missed. Thank you for joining us, and thanks, Kandyce, for making Medicare easy.
Thank you, Brice, and thank you, everyone. Have a great day.